everyone, I'm here today to answer some Q&As. So, although you guys didn't really ask me any questions, I found some online that I thought you guys would kind of benefit from. So, I have my cards here, and even though these things are huge, there's not that many questions. I think there's roughly about 1, 2, 3, 6, 7, 8, 9 maybe. Yeah, I'm gonna start the video. Let's get comfortable. I'm gonna be here for a while. Okay, so a lot of you may know I have cystic fibrosis. Well, a lot of you may not know what cystic fibrosis is. So what cystic fibrosis is, it's a genetic disease that you can only inherit from your parents. It has a lot to do with the lungs, the pancreas, the GI system. A lot of people have trouble with their sugar, like I do. So they have a lot of pancreas problems and things like that. There's just a lot of stuff that even in a video I couldn't cover. So, yeah, that's what cystic fibrosis is. Now, on me, CF affects my lungs. I have diabetes. I have CFRD, cystic fibrosis related diabetes. Which it's not quite considered type 1, but I do have to watch my sugar and I do take insulin. So yeah. And if you're seeing a lot of medical stuff over here, this will be another video. I'm on IV antibiotics right now, so anyway, that'll be another video altogether. So, let's get to the questions. Is cystic fibrosis contagious? Well, no. Cystic fibrosis is not contagious. You have to inherit it from both your parents, and both your parents have to have a certain gene. A lot of people ask me, hey, are you contagious? You know, I need to get away from you, you're contagious. No, I'm not contagious. Even though I'm coughing a lot, I'm not contagious. I just cough a lot. That's part of how I bring up my mucus. So, it's just part of life for me. How is cystic fibrosis diagnosed? Well, I know there's different ways you can do it, but the way I was diagnosed, right after birth, they gave me a sweat test, and it came back positive. Well, after they have to wait a certain amount of time before they can give you another one. So they waited that amount of time, gave me another one, and it came back positive too. So that's how they diagnosed me. Now, what a sweat test is, it's like this, I don't know, it's kind of like a blood pressure cuff that you put on your arm, and it just draws out the sweat, and they can test the sweat. So that's one of the ways that you can do, and it's not as painful. So, let's see what the next question is. What test will I use to monitor cystic fibrosis? Now, what I use, I know a lot of people do it different, well, kind of. There's different machines you can use. But the main thing that whenever I go to my doctors now, I do a PFT. What that stands for is pulmonary function test. And it monitors how much air you can take in and push out of your lungs. So, basically, if some of you follow me on Instagram or Facebook, I've posted a picture. It's like this weird thing. I can't really describe it. It's like this little circle thing and a mouthpiece. Anyway, you just go in there and look through my pictures and you'll find it. They use it and they monitor like the percentage that my lungs are. Like, I'm not really sure what they were last time, but I know before, like, there can be a 56 or 30%, 40%, anything. And that just basically tells you how good your lungs are doing. So, like, say if you're 40. Like, if I'm a 40, I don't really know what it was last time, but just used to it. Used to be, if I had a 40, I would be getting kind of sick, or there might be something going on in there, or I'm losing lung function. So they would usually put me on some antibiotics and see how I was doing after that. They would take it again, and like whenever I would go in the hospital, they do it probably once a week. And if it had gone up, they know that the antibiotics are working. But if they hadn't, that means that there was probably something different going on. So, next question is CF treatable? Yes, CF is very treatable. CF is very treatable. So if you saw me just do that, I had to get on my aunts over here. They're talking while I'm trying to make a video. Mom, instigator over there. Anyway, CF is very treatable. I know there's different types of treatments, but the way I do mine is I'll probably have to show you guys sometime in a future video, but I wear this thing called a vest, and it covers around this area, my back, my sides, and what it does, it vibrates a lot. And there's like different settings you can put it on, but so there's different settings you can put it on. Anyway, and I do breathing treatments. I do Xopenex, Pulmozyme, hypertonic saline, and sometimes I'll do a month on and month off of Toby. So yeah, that's 4 breathing treatments. And I do my vest twice a day. I do Xopenex twice a day. I only do Pulmozyme in the morning. And I do hypertonic saline twice a day. I do Toby twice a day. So that's how I manage it. Now, as far as working out, as you can see right here, I don't really work out, but I need to start, because now that I've gotten this new medicine, which is helping with my lung function to stabilize it, I've started gaining more weight, which is good. It's good, don't get me wrong. They're very proud of me because I've gained weight, but it's kind of starting to settle in places that I don't want it to settle. So I'm going to have to start working on that. I take lots of well, not really lots. I mean, I guess to some people out there it's probably lots of pills, but me, it's not a lot because it's been my whole life. So, yeah, you kind of just get used to it. Next question. Will I die from CF? Well, I mean, eventually everybody's going to die, so it's not really... yes, I will die, eventually. Maybe in 2 years, maybe in 4 years, who knows? You just gotta live life where you can. So, that's what I'm doing. How do I treat my CF? So, I just told you guys how to treat it. How common is CF? There are over 30,000 cases documented in the US alone, but over 70,000 worldwide. Now, has that number changed in the past few years? Probably, but who knows? Nobody can get an accurate reading. What mutation of cystic fibrosis do I have? I have 2 copies of the Delta F508 gene. Don't ask me what that means. That's just what I know. Okay, so that's just what I've always stuck with. I know that I have that. I don't know what it means, but I know I have that. So we have one more question. What is the life expectancy for someone with cystic fibrosis? Now, I Googled this, so Google may not be the same, but I also Googled it, and I went to the cff.org, cff.org, I think it's called, and it said about the same. I think they actually said 40, but kind of varies. The life expectancy is 37, but there have been CF patients that have lived way longer than that. Like, I think there's a lady out there that, she's like 80, I think. She could be a little older, she could be a little younger, but you get it. It just depends. Some people have worse cases, some people have much milder cases. It just depends on what kind of case you have, how well you take care of yourself, and everything like that. So you just kind of have to, like I said, live life. Because you never know when you're going to die. So, yeah. Okay, so I hope you guys have enjoyed this video. Mom, will you please come turn the recorder off? Hope you guys have enjoyed this video. I will be making more videos, hopefully in the future. And I'm going to make one right after this. I'm going to show you how I hook up my IVs and everything. But anyway, so there'll be more videos to come. But I encourage you to like and subscribe. Come on, let's get some subscribers going. Come on, come on, come on.